Awesome. Well, thank you all for joining us. Welcome to this month's Direct Care Workforce Collaborative, or this quarter, rather. My name is Brooke Snyder. I'm the Workforce and Sustainability Specialist on the Direct Care Workforce team at HCPUF, a part of Office of Community Living, and we're so excited to have you here today. We have some great opportunities to engage, also some great information coming from our workforce centers, so we're just super happy to have you and excited to dig right in. So with that, I'd just like to do a quick welcome slide. I'm going to go through this pretty quickly. Most of you have heard it a handful of times by now, but we are recording. So that's just a gentle reminder to avoid sharing any protected health information or any information you wouldn't want pushed out to folks. We do share the recording and post it on our website. So just be thoughtful of what you're sharing today. We are using the chat. I have lots of folks here helping me monitor that. So if you have questions or concerns or would like to share anything, you're welcome to use the chat. We will also post the slides out on our website along with the recording. We know lots of folks aren't able to join us at 10 o'clock on a Wednesday. And so we do make the slides and the recording available after that. So give me about 4 or 5 days. Once I get those accessibility checks, I'll get them posted to our website, which I will drop in the chat right now. If you're listening by phone, welcome. Thanks for being here. You can press *6 to unmute your line and *9 to raise your hand to participate in discussion. I have turned on closed captioning, and you're able to turn that on or off on your own screen by using your black toolbar. And then meeting information for this meeting and also our other Direct Care Workforce Collaborative meetings, including our action groups, can be found on our Direct Care Workforce website, which I've dropped in the chat. And that's also the website where the slides and recording will be posted. Just a quick look at our agenda today. We're going to run through some polls, do some quick welcome and attendance, some introductions on our leadership team. Then we have the Broomfield Workforce Center here to give us a quick Workforce Center 101 and how you can leverage their services in your local regions, which we're really excited about. We have a quick update on the Direct Care Workforce Stabilization Board as their recommendations were recently released. We're going to do a breakout room activity where our co-chairs are going to lead us through some planning post-ARPA. That's American Rescue Plan Act. That's what has been kind of fueling some of these projects we've been doing the last, I'd say, 2 years. And that is all coming to an end. So we're going to have an opportunity to kind of shape the way we'd like this group to move forward. And we want some feedback from you on that. And then we'll do some closing there at the end. So we're going to do, and there's so many of us here, we don't do regular attendance, but if you wouldn't mind just dropping in the chat your name, your location, and your role or your title. If you're joining us by phone, again, you're welcome to *6 to unmute your line or *9 to raise your hand, and we can capture you on the attendance. So I'll give folks just a moment to do that. That just gives us a bit of a roll call so we know who's here. I know there's a lot of familiar faces. You may know a lot of folks, but also gives us a chance to network a little bit as well. While you're doing that, I am going to welcome you if this is your first meeting joining us. First of all, we'd love to know how you heard about us. But this is the quarterly meeting of the Direct Care Workforce Collaborative. We do have bi-monthly action group meetings. Those are typically smaller meetings that really allow for those action groups to identify anything they'd like to push forward. This big meeting is really information dissemination, but those action groups have the opportunity to identify some specific stuff they'd like to push forward. An example was the Direct Care Worker Appreciation Week that we push forward that's happening every April now. We've had a story sharing blog. Some of that stuff has been created in those smaller action groups. Stakeholder voice is paramount in these groups. You'll hear a lot from me today, but you'll also hear a lot from our volunteer co-chairs who are integral in the operation of this group. And we want to hear from you as well. And so that's why we have some activities today that allow you to kind of give us your feedback and kind of shape the way that this group moves forward. So the purpose and the vision, the DCWC, we'll call it that a lot, is dedicated to advancing the general awareness of the direct care workforce. We advocate for improved compensation and benefits, training and career advancement, and publicly recognizing the significant value of the direct care workforce in all healthcare sectors. And we just want to make sure that our workers are skilled and qualified, well compensated, well respected, have those opportunities for advancement, and have highly sought after jobs that continually attract new entrants. So really focusing on that recruitment and retention piece. All right, so I'm going to run some polls quickly. We do have a handful of people here, which is great. I'll run through these fairly quickly, but this just gives us an idea of regionally how we break out, and also like how you join us and how you're connected to this work. So give me just 1 second to get those rolling. So the first one is where you represent regionally. Where are you joining us from today? I'll give folks some time to let that stabilize before I share the results. All right. So we're well represented in our regions 1 and 2 and 3, actually, as it turns out. A few folks joining us from Region 5, and then we do are missing some folks from our, Delta, Montrose, Western Slope region, and also the far southwest corner as well, around the Four Corners and stuff. So if you know folks in those areas that you work with and you want to share this information with them, we'd love to have them. But we'll continue as a leadership team to maybe do some targeted outreach to those areas, because it is important for us to have representation from all, so we can make sure those folks are heard as well, as a handful of our rural areas. The second poll is just how you identify on the direct care continuum. You are able to select more than one now, which is great, because we know a lot of folks juggle a couple different roles, especially if you're a family caregiver or something like that. So and again, I'll let that stabilize, and then I'll share the results for us. All right, so we have pretty good representation across the board. We're always well represented by our advocacy orgs, our employers, and our government agencies, but we're also excited to see that we have a few workers joining us today. Also, those members that are receiving services, and then the family members, which is really important for us to have their perspective as well. So thanks for being here. And then last but not least, we'd like to know how you heard about us. Right, perfect. So lots of employers sharing the information. We love that. We appreciate that. We have lots of folks joining from the HICPUF newsletter communication. That's John Barry's newsletter that goes out typically twice a week. If you aren't connected to that, I'm going to drop the link in there to sign up for that. It's not only our work, but it's also other work and stakeholder engagement opportunities for the Office of Community Living. It's just a great piece of information. It's a great place to keep connected. So we want to share that with you if you're interested. And last but not least in this section, I'd love for you to meet your leadership team. These are all volunteer positions. We appreciate them so much. And I'm going to kick it over to Oliver real quickly to just kind of popcorn through these folks. You get a chance to know them, and then we'll move into our first agenda item.
Awesome. Thanks, Brooke. As mentioned, my name's Oliver Giminero. My background's in mechanical engineering. For the last 8 years, I've been doing a lot of advocacy work, and I serve on other commissions and boards. I'm a C4 quadriplegic, and direct care workers provide me the ability to live a functioning life. So I'm really passionate about it. My mom was a nurse, so I grew up in that kind of hearing about the things direct care workers, some of the struggles they receive. So I just have a ton of respect and appreciation for all that they do. And so that's kind of what brings me here. I don't believe Penny is with us today, but Brooklyn, if you'd like to go, and then if you just popcorn off the next person.
Thank you, Oliver. My name is Brooklyn Reel. I am an HR generalist for Aerial Clinical Services. We have direct support professionals, and we have host home providers with our agency, and I'm very passionate about the work that they do because, they're they're the core of everything in this field. So we support, our agency particularly supports adults with intellectual and developmental disabilities. So that's why I'm here to bring a value and awareness in the work that they do. So, and I'm co-chair for the Value and Awareness Action Group. And Pascal, I'll take it off to you.
Good morning, everyone. My name is Pascal Adou. I was a previous director workers, been in healthcare for 25 years, and now I work with SCL Local 105. We advocate for director workers. So I'm a co-chair for the Value and Awareness Group. Very passionate about this work we're doing. I've been on this team for almost 4 years now, if my my memory is right. So we started this work 4 years ago, and we've seen some improvement, and we are so happy to see you here today. We have valuable people that cares about the value of a director workforce. So thank you so much for being here. And I'll pass it on to Deborah if she's here today. Thank you.
Good morning, everyone. My name is Deborah Lively. I am the president and CEO of Leading Age Colorado. We're a statewide trade association. We represent senior living and aging services providers who employ our direct care workforce. And I am also, for the collaborative, I am the co-chair of the Compensation and Benefits Action Group. And we're meeting next week on Friday at 10 a.m. So hopefully you all can join us. And I'll turn it over to my co-chair, Ashley.
Thanks, Deborah. Good morning, everybody. My name is Ashley Weber, and as Deborah has said, I am co-chair of Compensation and Benefits for Direct Care Workers, which is a passion of mine, as I too, like Oliver, am a quadriplegic, and I'm an advocate for the CDOS program, and have been on many stakeholder committees in regards to changes that I've seen needed to be on both the employer sides and the employee side. I will pass it on to Bobby.
Good morning, everybody. I am the co-chair for Career and Training Subcommittee. I have CP from birth, so I am very passionate about working with people with IDD, which is why I am a job coach for people with IDD and a advisor for independent living skills for that same population. I got into this field because I believe that people that care for us should be compensated for what they do for us and be able to live on that. I'm glad you're all here, and the next person is Galen. If he's
Hi, everyone. My name is Galen. I'm a residential program manager at North Metro Community Services. I'm the co-chair for the Training and Career Advancement Group, and I actually just started that like a month ago, so I'm still new and totally learning and happy to be here. I've been with DCWC for about 3 years now, I think. And it's really good to see representation from actual care providers here today. Bring all your
Awesome.
friends.
Yes, yeah, bring a friend next time. That sounds. Thanks, Galen. Thanks, team. We're so grateful to have such a dedicated team. They put in a lot of work behind the scenes, and we're just happy to have them each and every day. So thank you for being here. And with that, I'd love to pass it over to our Broomfield Workforce Center team to kick us off into our first agenda item.
Thank you, Brooke. Oh, awesome. You've got the presentation. I am going to try to do it without my notes. But I want to thank you very much. You're always so generous. You're always a huge wealth of knowledge. And when you asked, I think it was about a month ago, if we would do this, I said, of course we're going to do it. So thank you for having us. I want to introduce myself. My name is Clelia McVeigh, and I'm with Business Services at the Broomfield Workforce Center. And then Linda Anderson is joining us. I can't see where she is on this, so she will be popping in later. And then Mitch Fitro is also joining us. He is on the career services side. Okay, next slide, please. All right, so when Brooke had asked, just to give a quick overview, Workforce 101, I thought, okay, how many people have either heard of workforce centers or are using them? So I don't know if people can do a show of hands with that or thumbs up. And I can't see the results on it.
I can give you a quick
Okay.
rundown.
Okay.
Yeah, of folks. We've got a couple hands raised in the chat. 3. Yeah, we're getting, I don't know, I'd say there's 5 or 6 folks that are familiar, at least in using some three thumbs up. So
okay,
I'd say about a quarter of us.
Okay, so that's a perfect opportunity to tell you what we do. But who we serve, it would be employers, community partners, and job seekers. And why we do it is to create quality jobs for both the job seekers and the employers, and to really help solve workforce needs. So obviously in this industry, it can be a huge challenge. It is difficult, and really trying to be creative and help problem solve. But how we do that, there's a number of different resources that we have access to. Your organization is one of them. We do a number of workshops, connect employers to grants, connect job seekers if they're eligible to certain grant opportunities, and community connections and job fairs. So I have a link in this document, which will link to all of the workforce centers in the state. But if you are not working with anyone at this point, if you want to just send us an email, and we can connect you directly to either the career services side or the business service side for your closest workforce center. Okay, next slide, please. So this is a quick snapshot. Each area is completely different, but we serve not only Broomfield, but I would say Broomfield area. So part of Adams County, part of Boulder County. This is a quick snapshot of the numbers, which I'm not going to read to you, but this is from program year 2023. We're super proud of this. We are a tiny team. I think we are up to 19, I think right now, 19 on staff, and we serve many, many job seekers and many, many employers. Okay, next slide, please. All right, so I am going to introduce the fabulous Mitch Fitro, and he is going to talk a little bit about career services, what they do. I have to say our team is truly amazing, very patient, kind, compassionate. So if you are a job seeker, or if you know any job seekers, absolutely connect with career services. So I'm going to turn it over to Mitch. Thanks, Mitch.
Thank you, Cleo. Can everybody hear me?
Yes.
Awesome. So when I try to explain career services and business services, I always say at the workforce centers, we kind of have two sides of the house. So career services is interacting with clients and customers on a daily basis. And then Clelia and Linda are interacting with employers on a daily basis. And we try to marry those two sides together. So when someone comes into the workforce center, they may have a number of different needs. And so here's just a short list of some of the things that we can help out with. And one of the common misconceptions is you can only access workforce services if you are on unemployment or in between jobs. it's not necessarily the case. So some of these services we call our Wagner-Pizer services. So anybody is welcome to come in, get some assistance with maybe taking a career assessment, or a second set of eyes on their resume, or some information about labor market in the area. Anybody can come in at any time and utilize those services. We also have a resource room available for folks who need to make copies. We have computers in there, internet access. Any of those things we can help out with on the career services side. And then on the next slide, if we can kind of move forward, Brooke, is more of our case management, which falls underneath our purview on career services as well. So everything is based on individual need, eligibility, and then kind of the hidden one is suitability too. We have a lot of folks come in, they say, hey, I'd like to take this training, and we really have to be the deciders of, okay, does that make sense? Does the labor market back it up? Is that going to be a good fit for this person? Maybe they want their CDL, but they have multiple traffic violations in the last 6 months. We have to make those decisions and kind of come to that individualized decision on, what can we do to best help this individual? So a lot of that education and training is based on some grants that we have. I don't know if anybody is familiar with WIOA. So it stands for the Workforce Innovation and Opportunity Act. So those are federal funds that are disseminated to the state, and then the state disseminates them to the local workforce centers. So all of those are taxpayer dollars. That's why all of our services are free. That's one of the things I love to tell people is you're never going to have to pay back any of the monies that you receive from us. It is all 100% free, paid for you as a taxpayer. So we put some folks through education, training, career development courses, vocational certificates, sign them up for any of those computer classes. And then Clell and I are registered apprenticeship consultants as well. So dealing with employers who have gone through the rigorous Department of Labor verification to become a registered apprenticeship within the state of Colorado. Set folks up for some on-the-job training or work experiences, which really behooves everybody in the situation. So we have a client who is interested in a particular line of work, and then we have an employer who is interested in maybe giving somebody a trial run and giving them some experience in an area they may not have experience in before. We pay for those wages for a certain amount of time. That way the employer gets somebody to work for them and the customer gets experience in that field as well. It's really one of the best things we love to do. At the very bottom, the work tools and clothing and the transportation assistance. We don't always like to lead with, we can pay for some of those things, because otherwise we'd be inundated with folks coming to us for, gas cards and things of that nature. But if our clients have a barrier to employment that falls underneath some of those things, we'd like to remove that barrier when possible. So I'll kick it back to Clell to talk about business services, and I'll pop in when necessary.
Mitch, thank you. Sorry, I couldn't hit my unmute button. So I'm going to touch on youth services really quickly. Marcy is fantastic. Marcy Machuga, she runs our youth program, youth being 16 to 24. So what that encompasses, a lot of career exploration, high set classes, resume, mock interview, work experiences, but really trying to help the youth figure out, things that they're interested in, resources, any education, trying to connect them to their next step in their journey. We also do an amazing program. It's called Career Explorers. It's a summer program, 10 weeks. We do industry tours, all industries. It's fantastic. So the students get a true snapshot of what it's like to work in a particular industry. And at the very end, we do a speed networking event. So you can see on the bottom photo, and that's the students learn so much about themselves, about other industries, and then how people got into their role. It's never a straight shot, so it's a very eye-opening experience. But she's fantastic. If you're an employer and you hire youth, young adults, 16 and up, definitely connect to a workforce center. Okay, next slide, please. Okay, so with business services, I think Mitch kind of hit the nail on the head. We really try to work with our employers and then connect these opportunities to career services. And how we do that ultimately is really how and why is to strengthen your talent pipeline. Connecting Colorado is the database that we use. You are able to post any position in Connecting Colorado. It's a very simple registration process. We also have career fairs, recruitment events, hiring events. We can do candidate screenings, also do outreach specifically, provide assistance with apprenticeships, internships, and then, oh, sorry about that. And then also provide opportunities for skills-based hiring strategies. Okay, next slide, please. All right, so I think the best way to get started if you're not working with a workforce center is to set up an appointment with your local workforce center. And there will be a link at the end of the presentation, and it's also at the end of this slide, businessservices@broomfield.org. We can meet with you, find out what your needs are, where to connect you. Oftentimes, there's a lot of resources that you're not aware of, and we can connect those dots. Provide labor market information, give guidance on some grants, additional funding, financial tax credits. We have access to partnership opportunities and sector partnerships. So I put a link in this under sector partnerships. There's actually a behavioral health sector partnership in early October, and they are looking for partner organizations to participate. So if you fall within that category, please check that out. Under partnership opportunities, I just want to give you a quick example of something today. I met with UC Denver, and the person that I met with sets up internships. She is looking for potential internships around public policy. So I immediately thought of Brooke Snyder, and so I will be doing that introduction. But that's an example of partnership. We're always on the lookout in trying to connect an organization to a resource in the community, ultimately providing and creating a quality job. Okay, next slide, please. All right, so I know I have touched on Connecting Colorado. This is just a screenshot of the registration page. So if you are not registered, I would highly suggest it. Connecting Colorado, and it will pop up job seeker employer. Obviously, if you're an employer, you would create an account and you can post as many jobs as you like. If you are a job seeker, you can create an account and look for positions that way as well. There's no charge. It takes about 10 minutes or so to set up the account. And then I do want to point out top right-hand corner, you can select your language too. So for some job seekers, that is a definite bonus. Okay, next slide, please. All right, so I am going to turn this over to Linda. Linda and I are in the business services team. She has a huge wealth of knowledge, and if you have Connecting Colorado questions, she is the guru on that, and I'm going to turn it over, and thank you, Linda.
Hello, thank you, Clelia. Thank you so much. I'm Linda Anderson, as Clelia mentioned. I get the opportunity to work with her closely and with Mitch as well. So wonderful staff that we have. I did just want to touch on the benefits of using Connecting Colorado. a lot of employers will use something like Indeed and things like that. And that's great too. But with Connecting Colorado, you get the capability to search our database for potential applicants. So, and then you get individualized attention from the Workforce Center staff too. So just a plug for Connecting Colorado there. And I did want to touch on some tax credits and incentives that are available to employers and job seekers through the Colorado Department of Labor and Employment. So it's not exclusive to Broomfield Workforce Center. It's something that all workforce centers will offer. So the first one would be the Work Opportunity Tax Credit, which is WOTC. And basically, these incentives and tax credits are programs to enhance hiring capabilities from people from underrepresented groups. So WOTC can provide a tax credit to employers if the job seeker falls into a specific category, or, well, it's a pretty wide category. It would be welfare recipients, veterans receiving food stamps, disabled veterans, ex-felons, designated community residents, vocational rehabilitation recipients, supplemental security income recipients, TANF recipients, and unemployed veterans. So there's specific requirements from each of those groups, but Workforce Center is here to help employers navigate that and be connected to the state agency. Then there is also a program called the Federal Bonding Program. And as you can see, it's a fidelity bond provided to the employer free of charge. And it serves as incentive for the company to hire a job applicant who is in a specific category. It will help the employer to prevent theft, forgery, embezzlement, and larceny from a potential job seeker employee. And these recipients could be justice involved people, individuals recovering from substance abuse, TANF recipients, individuals with poor credit history or no employment history at all, and individuals that are dishonorably discharged from the military as well. And it can cover any job, any employee, full or part-time, temporary employees, as long as taxes are automatically deducted from paychecks. Another service that Workforce Center offers is layoff and job separation assistance. So there's a program called the Rapid Response Program, which offers services to the employer for restructuring or downsizing their business. It could be consultation on layoff aversion strategies, workshops for employees in transition, job placement assistance, and information on unemployment benefits, which we could come out in person, do something virtually, just however the employer, whatever needs they have. There's also a work-share program, which I don't think many people know about, but it is an alternative to laying people off. Whereas if the employer needs to cut hours, or lay off people, they can cut hours instead, and the program will help supplement the employee's wages. Okay, that was a lot. So those links are very helpful in this document. Next slide, please. Clelia mentioned that we offer job fairs and hiring events. These are really popular. We can do them in person or virtually. Broomfield Workforce Center holds a job fair monthly. It's usually the last or second to last Wednesday of every month. And they're super fun. We had, I think, over 100 job seekers come through the last job fair, and we can hold about 15 employers. So we love to get new employers. We can also have you as a resource if you'd like to share your services. That's something that we definitely have the capability to provide for you. Next slide, please. All right, I'm going to toss it back to Clelia to talk about the Office of New Americans.
Okay. Thank you, Linda. That was a ton of information. Thank you. I appreciate it. So this is an example of a partnership, and it's the Office of New Americans. I believe every workforce center is part of the O&A task force, and it's really just a resource to connect employers and job seekers. If they are looking for additional workforce and tapping into new Americans. I do want to highlight, it's the second to last bullet point, there is a webinar series, and it's for Workforce Development Month in September. It's called Supporting New Americans webinar series. So that link should be live in there. I believe there are 3 workshops that people can tap into, and there is no charge for that. Then the very last thing that I would like to point out on this slide, this is a virtual job board / resource board. It's called Virtual Connection to Work for New Americans. The platform is Premier Virtual. You can register as a job seeker, or you can also register as an employer, and it's essentially connecting the two. So this has been shared with career services, resettlement agencies, and also employers. And the last time I checked, I think there were 70 employers that were registered and posting positions. Okay, next slide, please. All right, so this is a shameless plug for Workforce Development Month. And this is a snapshot of some of the events that we have going on. For those that don't know, September is Workforce Development Month. We have been lucky enough to partner with several other workforce centers. We did a virtual job fair on September 5th, and then we are also doing an in-person job fair on September 25th. Depending on your area, there might be something that's closer, so you can reach out to us, or you can click on this link here. We do have a workshop coming up, and this is for employers that hire young adults, so say 16 to 18. Mr. Mark Kochman, he's with CDLE. He will be presenting a workshop for employers around youth employment law. So that link is live. That is on the 17th, so it's next week. And I believe it starts at 10, so registration is required on that. And then the last link that we have, it's just a link to our website, which will kind of recap all of our services. It also has a great calendar that lists all of our workshops coming up for both job seekers and employers. Okay, next slide, please. All right, so that was a ton of information. I think we did it in 18 minutes, and we were supposed to do it in 20. So 2 extra minutes.
Pretty good, pretty good.
I just want to open it up and see if anyone has any questions. And I would love to open up. I can't see the chat, I don't think. And if you're not comfortable putting it in the chat, all of our emails are here. We would love it if you could reach out. Again, we're in Broomfield, so we really help Boulder, Adams, that surrounding area. If you are an employer that's, say, south of Denver, we can certainly connect you to the right workforce center.
Perfect. Thank you. And while other folks think of questions, I do just want to point out for the recording, there was a question in there about are there resources for new immigrants with work authorization who are not yet English speaking? And so a couple resources were dropped from Broomfield Workforce Center, work closely with the Office of New Americans, but then also City of Denver has a New American Integration Network. So just kind of depending on where you're at within the state, it sounds like there are resources for new Americans as well. So good information there. Mitch, please.
Yeah, I just wanted to add that we also have translation services available for meetings with folks who, English is not their primary language. That is, super accessible for a lot of our individuals. And the only caveat for our non-work authorized folks is we can't enroll them into any of our financial assistance programs, but we can help them with job search, resume, all of those Wagner-Pizer services that I referenced before. So that shouldn't be a deterrent for folks who are just trying to get established in a job in America.
Thanks, Mitch.
Any other questions? And again, we'll make sure all the links are available when they're posted to the website. If you need it in the meantime, if you're just dying for the information tomorrow, I can certainly share links with you if you just want to email me. So thank you all. Thank you so much. Great information. Yeah.
Thanks for the opportunity, Brooke. And I think I mentioned we all have to drop. We have a team event shortly. So thank you for having us, and please reach out. Okay. Take care.
All.
Bye, everyone. Bye.
Awesome. Thank you. All right. So let's move into just a direct care workforce stabilization update. We have Eric joining us here. Eric, if you'd like to take the floor.
Thanks. Thanks, Brooke. I appreciate it. My name is Eric Yowie. I'm an outreach manager with the Division of Labor Standards and Statistics within CDLE, the Department of Labor and Employment. And my colleague, Carrie Chesney, and I have helped support the Direct Care Stabilization Board through the last more than a year as they put together their Workforce Stabilization Board recommendations. And so this board was put together or created by Senate Bill 23261. And pursuant to that bill, a direct care worker includes home care workers, employees, and independent contractors of a direct care employer. And the board has been directed beginning September 1st of this year to at least every 2 years provide to review the direct care industry and report recommendations to both the General Assembly, which is actually the legislature's committees of reference, and each of those committees of reference in both the Senate and the Chamber are basically their labor committees, and report to the General Assembly and the Governor's office. So those recommendations are hot off the press, and I'm going to go ahead and put in the chat, but I won't go through all of the recommendations, but I'll put in the chat the recommendations, a link to the recommendations. It's also available through our website at coloradolaborlaw.gov. And I'll just note a couple of things. The board put a lot of work into this. We had 4 public hearings held throughout the state. We had public meetings almost every month. They held public meetings over almost every month to discuss their possible recommendations. And what I linked to is their final recommendations. There's a little bit of a preamble there to help explain what the board's task was and who is actually on the board and were a part of putting those recommendations together. The recommendations are broadly geared towards improving working conditions and improving benefits and mitigating the impacts of racial injustice for direct care workers in their state. There were several topics or broad areas of the recommendations, and that included improving knowledge of worker rights. That would include increasing CDLEs, which Carrie and I both do. CDLEs know your rights trainings for their workers, and a big part of the recommendation is ensuring that those workers who take their know your rights training or any training that an employer requires, make sure they get paid for the time they took to take that training. To create a direct care worker platform. There's a few recommendations regarding increasing the direct care base wage to as high in the next few years, to as high as $25 an hour. There's some recommendations regarding benefits and industry standards as well. And like I said, if you want more information about those recommendations, they're available at that link. You can also reach out to us through our website. Also, I'm really easy to get in touch with as well. I'm eric.yoat at state.co.us. And we were allotted about 5 minutes. I apologize if I went through it too quickly, but if there's any questions, I'm happy to answer, or we can move on to the leadership team.
Thank you, Eric. Let me see if anybody's got their hands up here. Any questions coming in the chat? And you all do have a Know Your Rights training coming up. Is that next week or soon?
Yeah, we do have one coming up, and it's also available at Colorado. The link is available at coloradolaborlaw.com. Let me see when that is. That is Thursday the 19th at 5:30. It is a Zoom training, and anyone, whether it's consumers, workers, or employers, are invited to attend those trainings.
Awesome. Thank you, Eric. That's great. We've been heard great things about that. Really encourage folks to check that out and share with workers as well. So
cool.
Awesome. Well, no questions, so I guess you're off the hook.
Well, thank you. I appreciate it.
All right. Thanks, Eric.
Bye.
All right, folks. So we're going to move into the planning post ARPA, where co-chairs are going to kind of take us through some Jamboard activities and some conversation and discussion. But I'm going to pass it to Oliver quickly to give us just some background and really level set for this activity. So you go into your breakout rooms knowing what is expected. Oliver, please.
Hi, thank you, Brooke. Yeah, so the Direct Care Workforce Collaborative was created before ARPA, and so we're separate from ARPA. Although when ARPA came along, it was a great opportunity for us to provide feedback and help direct where some of those funds went, and help be a stakeholder in the voice of what's important to our community. And so I think that was some really good work, and I'm excited about some of the things that came out of it. A lot of the projects that we HICPUF took under ARPA were direct care related. So I think that's exciting stuff. But here we are now, ARPA is ending here at the end of this year. And so we're kind of looking to redo our charter and update our charter and make sure that we're representing the community and doing the best for what we can in our direct care workers. So right now we're looking at redoing our charter, and we're making some small changes, but nothing too big. But one of the things we were looking at doing, and this will come up in the meetings, but I just wanted to provide a little backdrop for that, is we want to make sure that our 3 pillars are action groups are still pertinent to what we're needing to do. So we're looking to get feedback on, should we keep those groups the same? Should we make them goal oriented? And then we want to hear feedback from you. I think you go to the next slide, Brooke. About our action groups and about this whole group as a whole. So that's what we're here to do. We're going to break up into, I believe, 3 action groups, and there's going to be 1 action group that's going to just, or not action group, we're breaking up in 3 breakout rooms. And 1 room will stay here at the big group. I know a lot of people attend these meetings aren't able to really talk or provide a lot of feedback. So if you find yourself in that category, you can just stay in this room, and there'll be a jam board if you want to contribute non-verbally. And then our other breakout rooms will have co-chairs from each of the action groups, kind of help facilitate those. Did I miss anything, Brooke?
No, I don't think so. Just a few FYIs before you move into these rooms. I'm going to set you up here. You'll go into the room, and then I'll need just a minute to get your facilitators moved over. I have to do that a little bit differently. But again, like Oliver said, if you're not able to join the discussion orally, if you're not able to participate in, like outside discussion, you can go to a room, but then remove yourself and come back to this main room. I'll be here. I believe Ashley's going to be in here with me. We'll provide the link to the Jamboard where you can just type your responses to the questions. So this will be kind of the silent breakout room. But certainly, yeah, just come back to the main room. But as a reminder, when you come back to the main room, either when the sessions are over or coming back to participate in the silent breakout room, there are 2 options when you go to leave. There's leave the breakout room, which is the one you want to select. The other one is leave the meeting. If you select leave the meeting, it'll kick you out completely and you'll have to rejoin. And so that's just a quick reminder to make sure you're selecting the right one. Otherwise, make sure you come back and join us. So let me get the breakout rooms going if you'll give me just a moment. And like I said, come back to this main room if you're not able to participate in the discussion verbally. All right, let me see. Did everybody get the perfect? All right. I will just double check that I got everybody moved correctly, and then I'll come back to you all and share the Jamboard for our silent breakout room. I know we're cutting it a little close here because we do want to still leave time for the open forum. So maybe if we could do just like a quick rapid fire, I can tap each group leader to just give me 2 quick themes or 2 themes of conversation you had. So Oliver, how was your group?
It was good. We thought there was still need for some of the action groups. There was talk about, the Holy Grail insurance, increased opportunities for employees to have insurance. We talked about having different times, maybe noon, lunch break, maybe, or early afternoon. Gosh, I think those, for some reason, those are the big ones. We had some good input about maybe taking some of these questions in the breakout rooms and making a quick survey. And so then we can present the survey to like direct care worker or people that aren't able to attend the meeting. And then maybe be a source for us to get some other input.
Awesome. Love that. Thanks, Oliver. Let's see. Galen, I think you were group 2.
Yeah, we talked about some of the language around the name of the group is career advancement as far as that goes. There was a lot of discussion about how um, the people that are in the DSP position sometimes don't want to advance. They enjoy the work that they do, they love what they do, and so advancement may not be what they're interested in. And the pressures to do the training. We also talked about transportation being a issue and how it's difficult to get um, get our caregivers to remote places where there aren't a lot of services and the transportation, them using their own cars versus the provider agency providing transportation vehicles to transport them from wherever they are to the individual who needs services. Just wear and tear on vehicles, the expense to the company, the expense to the agency as far as like providing uh, compensation and benefits for that as being like a focal point. Sorry, I
Okay.
did the questions in reverse order because,
No,
yeah, I
that's
went
fine.
backwards.
No, that's perfect. No, that's how the conversation. It's perfect. And then last but not least, we had Bobby. How was your group?
The group was good. The primary discussion was legislation and how it affected attendant care and how we wanted to make sure that workers um and participants stay in the loop of how legislation is going to change the future of attendant care and how the changes will benefit attendants.
Awesome. So
I
sounds
hope
like a lot
that
of
was a
great.
good summary. I hope I didn't miss anything.
No, and that's why we have the jam boards, Bobby, too. And I think it's going to be a continual discussion. So we'll, as a leadership team, kind of collect the jam board discussion, pull out some themes, and then we'll also look at doing a survey as well, just to make sure we're able to hear from folks who aren't able to join
I
us.
like
So
the idea of a survey, so that's good.
definitely, yes, definitely. All
Quick question,
right, yeah,
This jam board will be open for a couple days too, right? So people,
yes.
if they wanna contribute.
Yes. Yeah. And then the Jamboard, unfortunately, is going away October 1st. It'll just become like a read only, but we'll make sure that it stays open for a week or so for people to continue to put info in. And then we'll capture everything from there as well. So thanks, Oliver. Good point. And it looks like Oliver has dropped the link in for everybody, and we'll make sure we send it out. So thank you. That's great. All right. So moving quickly into our open forum, I am just going to make a quick plug really quickly, though. For our 60-second feedback survey on these meetings. This really, in addition to the conversation you had in your breakout rooms, this really lends itself to what you want to see in these meetings moving forward. It allows you to give us feedback on the time we spend on things, the topics we have, and then what you'd like to see in the future. So I'm going to drop that link in the chat while I move us into our open forum. Do we have anybody with announcements they'd like to share? Katie, please, yes.
I think you're still on mute.
Sorry, thank you. Hi, everybody. I am Katie Talercio, and I appreciate this work you all are doing. I actually have more of my career work experience in direct care, but then have become a state employee and worked for healthcare policy and financing for a while on support employment, and now working at the Division of Vocational Rehabilitation, but in a bit of a collaboration like you all have here, where we're all working together to figure out how people with disabilities can get to work and grow in their careers as desired. And because it's kind of confusing to explain who we are and what we do, we decided to try and have a little bit of fun with it. But also, I feel like just listening to the conversation I got to hear just now, you all might be ideal for something like this if you're interested. We're launching what we're calling our Big Idea Contest. And some people have said, Katie, people are intimidated by a big idea. So I just want to make sure I tell you all that it doesn't have to be very big. It can be little, it can be tiny. But we have cash prizes, and I'm just going to put in the chat a place on our website to go to. But we're really just looking for, oh my gosh, if only this were in place, it would make all the difference, right? Like what if only this could happen? And it could be a team ask, and it could be an individual ask. And what we'll do is we're going to collect all the ideas until September 20th, and then we're going to vote on them. And the first place winner will get $250, and the second place will get $150, and the third place will get $75. And I should also mention that we have some priorities within our Employment for All partnership, where we're working with youth to get jobs. We're working with supporting employers, and we're also working on how can we expand our resources and partnerships. And one of those, I will say, topics that came up in our small group here today is transportation. So that is a partner that we're trying to expand awareness and resources on. So those prizes will all fit within one of those categories, but we also have a wild card for $25 in case it doesn't fit in one of those. And once it's voted on, we hope to see it happen. We can't promise anything, but if it gets voted on, the community really wants it, we're going to try and work with you to make it happen as much as we can. So I'll post that in the link, and I just want to say thanks for giving me this time, and thank you for all your work.
Awesome. Thank you, Katie. That sounds exciting. So look forward to getting that in the chat there, and we'll make sure that goes out with the notes as well. Perrine, please.
Hi, everyone. I'm Perrine. I'm with the Bell Policy Center. We're a statewide policy research and advocacy organization, and I just wanted to share an opportunity. We're currently working on a project in partnership with Easter Seals, Colorado, to better understand sort of the mental health needs of family members or friends who are caring for a loved one who is either an older adult or a person with disabilities, and to ultimately learn how we can better support the mental health needs and understand what those are in the state of Colorado. And so we are sharing a survey. It's pretty short. It should take no more than 10 minutes. We have it in English and in Spanish. And we also have an opportunity to win a handful of gift cards for completing the survey. And just as a note to please feel free to share widely with your networks if you're caring for a loved one, or if you know someone who is, or just work with folks or organizations who might be. Please feel free to share it. I'll share the links in the chat as well as my email if people have any follow-up questions. Yeah, thank you.
Thanks, Perrine. Really important work there. So thanks for bringing that to this space in this group. Any other announcements, open forum, questions?
Yeah, this is Lisa. I wanted to mention. So I'm part of a foundation called the Colorado Paralysis Foundation that has officially gone live, and that our main goal, it's a great site with some good blogs. And three of the individuals we have on the committee or the foundation are those they have spinal cord injuries. But our main focus is training caregivers, at least right now, to the specific of paralysis. And it'll eventually move into to brain injury and hopefully expand from there. But right now, our first class tentatively is scheduled for November 1st and 2nd, and all the classes are done at Craig Hospital. And so we're getting the names out to agencies, to agencies, to CDOS. I've been talking with, I think it's John Hendesky, about putting the Colorado Paralysis Foundation website link on that site. Especially from the training standpoint, because there's good training videos, but there's really not a whole lot hands-on. And the fact that it's done at Craig, it's used with, you're using that equipment, and it's in that big setting. And, we're really excited about that. And then we did receive a $20,000 grant from the Christopher Reeve Foundation. We're actually considered the first, I want to say, affiliate of the Christopher Reeve Foundation. So again, really excited about that, but we're trying to get the word out so that we can start, teaching caregivers that want to learn about how to care for paralysis, spinal cord injury. And I can add the website to the chat. I think I got that.
Perfect. If I don't see it come through, Lisa, I will reach out to you and make sure that makes it in the notes for folks to see when it goes out.
Thank you. I appreciate
that.
Thank you.
Thank you. All right. Any other announcements? I do have one plug for our HICPUF team. If you don't know or already, we are launching it's our next administration of the Direct Care Worker Satisfaction Survey. We fine-tuned it a little bit. As you might know, we've run this 2 times before. And in that time, we really honed in our questions around benefits, what you're receiving. It's also just satisfaction around the job that you do, why you do it. And we're really just wanting to hear from direct care workers. This is our final push. We were thinking it was going to be open through the end of this week, but we've had a lot of folks kind of trickling in these last few days. So we're going to extend it until the 20th, but then that's like the hard end date. And so this is for workers themselves. So you'll see that it says the current cycle is now open through September 13th. Push that back a week. I'll get that updated in the slides through the 20th. We want to make sure you know that it's confidential. All data collected is aggregated, and so nothing can be traced back to like your individual employer or even you. And so we just want you to share this. It's a general survey link with any of the direct care workers in your life and in your networks. Push out this link so we can really understand where they're at, so we can use the data to, support our initiatives moving forward, keeping track of that data, policy planning, stakeholder engagement, and of course, improve quality assurances. And so Heather is our hype person in the chat. Currently 754 completed surveys as of today. Goal is 950. And so that would be quite a bit more than not quite a bit, but a handful more than we've gotten the last couple times. So we're really pushing for that. So I will drop that link in the chat for you right now. And like I said, share away. So with that, we're moving into our last 5 minutes. Oh, Heather, we're still hyping. All right. So far, 50 counties are represented in the completed survey. So we're trying to reach all of our counties as well. So still just continue to kind of hype and stuff. And you can probably assume that the people who aren't here, our southwest corners and kind of that area may be the ones that aren't getting the survey information. So if you know somebody in those areas, make sure you push the survey out to those areas for us so we can get their words and their thoughts as well. All right. Any other announcements? Open forum. Taking us down to the wire. Awesome. All right. Well, let me go ahead and move us out then. Another shameless plug for the feedback survey. I know we're dropping a ton of surveys in the chat. I understand that. This is one that remains open continuously. So you don't have to complete it today or even within the next week. Just maybe bookmark it. And when the thoughts hit you, go ahead and complete that feedback survey just to let us know how we're doing. We really do. We review those. We kind of coordinate based on those responses. And so it's really important for you to tell us kind of how we're doing. All right. Our next collaborative meeting will be the end of the year, which is wild. December 11th, 10 a.m. to 11:30. We'll have action group meetings. Like Deborah said earlier in the meeting, we'll have compensation and benefits this month on the 20th. And then we'll also have value and awareness this month on the 27th. We'll take a break in October, but we'll all come back together in November for the action groups and then the full collaborative there in December. I'll drop some links in the chat on some resources of our survey websites, our collaborative website, and also that Direct Care Career Center, the job matching and resource site that's housing the Direct Care standardized core curriculum. I'll put some of that information in there, and then we'll also be included in the notes. And I just want to take a moment to say thank you. Thank you for joining us. Thank you for sticking with us, all 34 of you, through the end of this meeting, in the breakout rooms. Oliver, Penny, any parting thoughts before we let folks get on with their day?
I think that's good.
Awesome. Thank you all so much. Let us know if you need anything, and we will see you next time. Take care.